Kristine Hodson with the RDH E-Village, and we're here at the Greater New York Meeting 2012, and I'm so excited to hear about some new products from Hu-Friedy. I'm here having an opportunity to speak with Theresa, Biernet.
Kristine, last month we introduced our Implica II Scalers. These are new scalers that we have from Hu-Friedy. They are made of a high-grade unfilled resin on the tips of the scalers. This resin is called Plasil. Okay? It's a resin material, but it's very strong, and we want it to be strong to be able to get the debris off of the sides of an implant. This material has been tested, and the research has shown that it causes the least amount of surface damage to abutment surfaces on implants. That's important because as you're scaling an implant, you don't want debris, plaque to be accumulating on the abutment surface because that can lead to things like peri-implantitis, peri-mucositis, and you want that to be nice and clean for your patients. An upgrade that we've made in our Implica II Scalers is that our original 3 designs, the 4R, 4L, the 204S, and an H67 are now all 20% thinner. So with the thinner working end on these Implica II instruments, hygienists have more access with them. They can get them into areas that maybe previously they couldn't get these into before. We've also supplemented our line with a Barnheart 5.6 and a Langer 1.2.
Nice.
This gives the hygienist many variable scalers to use to scale implants. As you know, implants can be a single implant. Patients can have 2 implants. They can have implant-supported bridges. And so one type of scaler or 2 types of scalers is not going to cover all those different variations in the patient's mouth. So with our 5 different scalers, it gives clinicians more of a choice and an opportunity to select the scaler that meets their needs when scaling implants.
That's fantastic, especially from a hygiene perspective too. With the tissue being tight around
the
implant, it's hard with those big bulky to get in there because you don't want to compromise the tissue. So that's
absolutely,
fantastic.
And having this 20% thinner is what our hygienist feedback gave to us, is that they wanted a thin implant scaler, but we still wanted to keep it with something that research showed does not hurt the abutment surface on the implant.
So these untwist, is that how that works? Is that what I'm looking at here?
They're single use, they come off, and then they screw back on like this.
Okay.
So you can repeatedly use the same handle. You can keep the handle. They're single-use tips.
Great.
They're nice. You can see they're resin, but they have a nice stiffness to them to come and scale around the sides of that implant.
Fantastic. Now, what else do you have as far as with your product line to help support implants when we're taking care of them clinically?
Kristine, the other thing we have is our ColorView Probe. ColorView Probe has been out for a while. This is a great probe for hygienists. You know, when they're probing a patient, having it be black and yellow like that is perfect.
Yes.
They can see very easily. But the nice thing about this probe is it's made from a resin also, so you can very safely, again, probe around implant surfaces without fear of damaging those surfaces.
Okay. Now, if I'm interested in purchasing this back in my practice, what's the best way for me to get additional information?
The best way is to either go through your dealer and ask them for Implica II, the variations that are available, or you can go to our website at Hu-Friedy.com and order through the website.
Great. Thank you so much. I'm excited.